Hi, my name is Michael. I'm a student at Arcadia University in the Department of Public Health, and today I'll be presenting my systematic literature review regarding the effectiveness of smoking cessation interventions in promoting long-term quitting habits. So just to start us off with some quick background regarding my poster, cancer is one of the deadliest diseases in the United States. Its fatality rate is second to that of only heart disease, and it kills hundreds of thousands of people every single year. Between 80 to 90% of all lung cancer cases specifically can be traced directly to either first or secondhand smoking. And according to the CDC, the most effective way of minimizing this risk of developing cancer is to simply quit smoking. Throughout the course of my review, I discovered that there was a literature gap in regards to maximizing this long-term cessation at least 1 year post-quit. This 1 year was defined as long-term because not a non-significant amount of relapse rates occur after this period of time. So just to go over some of the key findings of this review. First off, when comparing long-term quit rates of multimodal interventions to their behavioral control counterparts, only one of the 5 studies included in the review showed significance. Secondly, intra-comparisons of multimodal interventions defined by adjusting the duration or the type of treatment used throughout the intervention were only significant in 1 of the 6 studies that were reviewed. Furthermore, quit rates of behavioral interventions were, for the most part, significant when compared to a simple cessation control performed by giving a pamphlet or a short piece of advice given by a physician. Furthermore, in regards to pharmacological interventions, the one study utilized e-cigarettes and actually showed significance at increasing long-term quit rates. And finally, a simple adherence to medications such as varenicline throughout treatment significantly impacted long-term cessation in multimodal studies. So why is this important? Some of these findings suggest that multimodal interventions may not be more effective at sustaining long-term quitting behavior compared to other proven effective treatments such as behavioral or pharmacological interventions. In the literature currently, the evidence points to multimodal interventions being perhaps the most effective at this, whereas this review shows otherwise. Furthermore, the adherence to treatment is may be more important than the type of intervention used. In addition, e-cigarettes may be an effective aid in treatment and helping with cessation efforts in getting rid of tobacco products for individuals. And finally, varenicline, the medicine that I mentioned earlier, was shown to be effective at causing long-term cessation as part of a multimodal treatment. So essentially, additional research is needed to examine which interventions are the most effective at fostering long-term cessation past the 12-month mark. And in addition to that, behavioral counseling, varenicline, and e-cigarettes may be effective in promoting long-term quitting habits. And that is my systematic literature review, and thank you very much for listening.